Speaking of mental health, more than 2,000 California mental health clinicians set to strike. Thousands of mental health therapists at the country's largest nonprofit HMO are poised to strike this week, holding daily picket lines and rallies outside Kaiser facilities throughout California. The unionized psychologists, therapists, chemical dependency counselors, and social workers are demanding that Kaiser Permanente provide desperately needed services to its patients, claiming that some wait months for needed therapy sessions. The open-ended strike is set to begin Monday. The National Union of Healthcare Workers, which represents 16,000 workers in California and Hawaii, said Kaiser staffs about one full-time mental health clinician for every 2,600 members, leading to therapists leaving Kaiser at a record rate, the union said. This is one of those things that is just insane to me, right? Like, we have this system where you need to have private healthcare, but, like, they don't even do their job, right? Okay, so I'm supposed to pay for health insurance, and then they sell me a product, healthcare, and then I don't get that product? Like, I have to wait 3 months to get a therapist? Like, what is a monthly health insurance payment? And you're telling me you can see a therapist once every 3 months? So that's like, what, one therapist for, not to mention the deductible and copay, but like thousands of dollars for every appointment? Are you joking? Are you joking? It's like going to the dollar store, or you're just going anywhere, and like buying, like, I don't know, anything, like just any item. Like, imagine buying a pair of scissors, right? But it's in a package. You open the package, right? And then there are no scissors. It's like a piece of cardboard that's like, it looks like scissors when you look at it through the packaging. And then on the piece of cardboard, it says, you know, mail in $10 to this address, and then we'll send you a pair of scissors in 6 to 8 business weeks. What? But I thought I just bought the scissors. You know what I mean? That's a weird analogy, but... Quote, patients are getting ripped off while Kaiser's coffers are bulging, Union President Sal Rosselli said in a statement, "We don't take striking lightly, but it's time to take a stand and make Kaiser spend some of its billions on mental health care." Exactly fucking right. The strike comes as the country experiences a surge in mental health issues. The World Health Organization said the first year of the COVID pandemic triggered a 25% increase in anxiety and depression worldwide. And a pediatrics group last year declared that mental health challenges among children during the pandemic had become a national emergency. The union said that patients who need therapy every week or every 2 weeks are waiting months to start therapy regimens, and then another 4 to 8 weeks between appointments. So you can only see a therapist every fucking 1 to 2 months? Again, how much money are you paying in monthly, as well as, again, deductibles and copays? In a statement, Kaiser Permanente said the two key issues the parties are bargaining over are wage increases and the union's demands to increase the time therapists are able to spend in tasks other than seeing patients. Kaiser said they have proposed an increase in time allocated for administrative work, but the union is demanding more. In a release, the striking clinician said Kaiser, which reported an $8.1 billion net profit last year, refuses to adequately invest in additional staff, take steps to reduce the burnout of current employees, and do what is necessary to bring its mental health clinics into parity with other health services the HMO provides. And that's another point of, like, if you're overworked, if you're a therapist and you're overworked, right? Guess what? You're not going to be that good at your job compared to if you're not overworked, right? If you're overworked and you're just like, you're tired, you're not sleeping properly, you're not going to be able to provide the service that you're required to, as well as if you actually had to work a normal day, or if you didn't get overworked, or if you weren't like doing like fucking 17 overtime shifts. You know what I mean? So that's the other thing, is not only do the workers suffer here, but the patients suffer. The patients suffer tremendously. Kaiser said the union is exploiting current challenges as a bargaining tactic. Go fuck yourself. This quote, despite I don't care what they have to say. In 2014, Kaiser was fined $4 million for issues with its mental health services. California is also navigating investigating whether Kaiser is providing adequate mental health care to its members. The clinicians voted in June to go on strike after a year of failed contract negotiations. Last November, unions and Kaiser management reached an agreement to avoid a strike at 14 West Coast hospitals and hundreds of clinics and medical offices. The strike would have included 32,000 union, blah, blah, blah. Anyway, so all the power to these motherfuckers. And this was written on Sunday, August 14th. So Monday in this article is referencing the last Monday. So they should be striking already. But again, like these fucking corporations, they will take your money and literally not even give you what you're paying for. How fucked up is that? They make so much money and they won't even give you what you pay for. It's crazy. Imagine like doing like online shopping, right? And you're like buying like a stuffed animal, right? And like in the mail, like you get like an envelope, a letter envelope, and you unfold it and it's a piece of paper with a black and white print of the stuffed animal on it with a note at the bottom that says, "I hope you enjoyed your purchase." You'd be like, what the fuck? I thought I bought healthcare, motherfucker, and now you're telling me I got nothing? Stupid ass shit. Stupid ass shit. And it's sad. Anyway, damn. What a show. What a show.